reality for all of us is we'll all die at some point. And with the ageing population and people getting older, there is increasing need to think about how we manage care for elderly people at the end of life. And what we're wanting to do is say we need to improve services, but more than that, we're also saying that society as a whole has a role to play in this, and we're wanting to address that. So we're wanting to improve services for people who have limited time left. It's not about them dying, it's about making the most of the time they've got left, whether they want to spend it having outpatient appointments at hospital or whether they want to spend more time in a home environment or on holiday. We want them to make some decisions. And also right at the end, whether they want to be at home or in a hospital environment for their last days. At the moment, they're about 55%, 50 to 60% of people, 5 in 10 people dying in hospital in this area. And we know that most people, given a choice and given appropriate services, would like to die in their own home, whether that be their domestic home or their nursing home. So we need to, at this point, to say, right, as a health service and as a society, what do we want to do to improve care at the end of life for people? I think the other big issue is dying is not just about the individual. There are people around them. There are loved ones and carers, and we have to say, how can we help them as well through this process? And not just when the person dies, but after they've died. Bereavement's a big issue, and supporting people through that. Once we know that what the public want and what we see is the way forward, I think there's several things we have to happen. One, within statutory services, we need to make sure that the services we provide meet the needs of individuals. So if the majority of people do want to die at home and it's a planned death, then we need the support services, not just 9 to 5, Monday to Friday, but 24 hours a day, 7 days a week, Christmas, etc., etc. Death doesn't stop during the working hours. So services have to be kind of renewed. It's not just the immediate, we're looking long term here, because with an ageing population, perhaps things like planners and houses, every organisation can look at what they're doing and saying, are we making this more older people friendly for those that are coming at the end of life? So we can plan things in houses. Care homes, we can train care home staff so that they're better equipped to deal with people at this time of life. We've talked about planned deaths, but sudden deaths happen as well, regretfully. And this isn't just about old people, it's about young people as well. And I think, again, in the Northeast, we're not good talking about it, but maybe people could think, well, what happens if, unfortunately, I am a sudden death? Would I want to be an organ donator, for example? We've got in the region a new transplant unit. We have people waiting for organs. Is organ donation something somebody would like to do? And if you're a young person, you can do that, but you also need to discuss it with your loved ones, your mum and dad if you're not married, so that in the event there was a tragedy, sudden death, then at least they know what your wishes were. And then there's not all the anxiety and worry about doing the best for you.